pivot to implement online learning. Some schools have been more effective than others, but many had to print paper homework packets simply because their students do not have access to computers or internet service at home. In Houston's largest school districts, nearly 140,000 households do not have a computer, and over 200,000 households do not have internet access. We're working on both of those. Now more than ever, we need our internet service providers, businesses, and others to help close that divide. And today, I'm happy to report that Russell Westbrook with the Houston Rockets and his Why Not Foundation are doing just that. He has generously purchased 650 computers for students and families in collaboration with CompuDot. The computers will be donated to young people who reside in the city of Houston's 10 complete communities neighborhoods. And they have been working very closely with the Director of Education for the city of Houston, Juliet Stepetch, and Brandon Denton, who have been working to help to facilitate and make this happen. And let me pause to introduce Russell Westbrook. He's not here in person, but he is with us today from Los Angeles. Well, until Russell comes in, let me introduce Colin Dempsey, the Executive Director of CompuDot Houston. Colin.
Thank you, Mayor Turner. So we're excited to announce today that CompuDot will be receiving 650 computers from Russell Westbrook and his Why Not Foundation. We at CompuDot are a nonprofit committed to providing. Oh, there's Russell. Russell, can you hear us?
Hey, Russell.
Hey, how you doing? How you doing?
We're doing fine. Russell, let me thank you. Let me thank you for your contribution for the 650 computers, and now it's all yours, man.
Thank you, man. Appreciate it. Thank you, guys. First, thanks, Mayor Turner. Appreciate it. Extremely excited to be able to collaborate with CompuDoc and find ways to be able to impact the youth immediately. Something that I'm very, very passionate about throughout my foundation, and just trying to find a way, especially now, to be able to bridge the gap and giving kids access to, obviously, another way of learning through computers, and allowing them to be able to continue their education, especially from home. So I'm excited about it. I'm happy to be a part of it.
Well, I want you to know we appreciate it, and man, on behalf of all the kids, thank you so very much. Appreciate your generosity. This is not the first time you've stepped up for people in the city of Houston, so very much appreciate it. And then look, can't wait until the season starts, and then you and I are able to continue to play again on the court. And so wish you all the best. Okay. Now let me bring back, I know you've been working with Colin. We're going to bring back Colin. Colin, why don't you come on back?
All right, so thank you, Russell, for your generous gift. Since March 18th, CompuDot has had over 25,000 families apply for a computer, saying that they don't have one at home, not even a working computer to get any one of their students able to work from home, and they're relying on those paper packets. So CompuDot on March 18th established a computer drive-through for families in Houston. Since that time, we've given out over 1,000 computers and plan to continue distributing 400 computers per week, thanks to leadership gifts like Russell's and other corporations and foundations in the community. So just want to say thank you to Mayor Turner, the Mayor's Office for Education, and you, Russell, and your Why Not Foundation for supporting our work here in Houston. The model's proven so popular here that we're expanding to places like Chicago and Dallas. So if folks are interested in learning more about how they can help join Russell in supporting our work, or interested in getting a computer for their student in Harris County, you can go to our website at www.compudot.org. Thanks.
Thank you, Colin. And then Juliet, you want to briefly explain just what this means for our kids?
So first and foremost, I just want to say thank you to everyone who's here today. We are just so deeply appreciative. Students are in such critical need of being able to have access to digital technology at this time. This opens doors for today, tomorrow, and their future. So thank you to everyone here, in particular Russell and CompuDot, and also the leadership of Brandon Denton, who has worked very, very hard in this collaboration as well. And of course to our mayor for your leadership and vision to always make sure that our children and our students remain served. Thank you.
Russell, thank you, man. Appreciate you. Can't wait till the season starts, okay? Thanks. All right, thanks, Colin. Thank you all. Thanks, Juliet. Thanks, Brandon. All right, today the Houston Health Department is reporting 115 new cases of COVID-19 today, bringing the total case count in the city of Houston to 2,239. That's 115 new cases today. The total number of deaths in our city is increasing by 2. So that will bring the city's count of people who have passed as a result of COVID-19 to 18. So that's 18 in the city of Houston. The 2 new deaths include a Hispanic woman in her 90s with underlying health conditions who passed away on April the 11th, and an African-American man in his 70s with underlying health conditions who passed away on April the 19th. That means, if you want to just break it down, of the 18 deaths that we've had in the city of Houston, 10 have been African American. Most of those have been African Americans and Hispanics. And so let me pause on that note. Well, let me just also add, the testing capacity in the city of Houston has doubled at City of Houston's mobile testing sites. Last week we had the capacity to test 250 at each of the 2 sites, and now the Houston Health Department will be able to test 500. We were given that approval on Saturday. Earlier today, I was at Cullen Middle School with Congresswoman Sheila Jackson Lee, who partnered with local doctors, UMMC, to open a private testing site located in a vulnerable community at Cullen Middle School. That's right between South Park and Sunnyside. Starting today, because we've been able to double the amount of testing, we will begin offering testing to anyone who wants it, not just those who are showing symptoms. So whether you are symptomatic or asymptomatic, showing symptoms or not, you will be eligible to get testing. This will give us a better idea of community spread in the city of Houston. And so let me pause at this point and bring up Dr. Peirce.
Thank you, Mayor. And the Mayor makes a big announcement in our increase in both the volume, and that's probably actually going to take us a couple days to actually get to 500. But we're going to be changing the criteria so that anyone who wants to be tested can be tested. Now, let me just put a little asterisk and remind folks what we've been saying all along. The reason we've been testing folks who were symptomatic before was for 2 reasons. One is, with most viruses, those are the individuals that push the virus through the community, those who have symptoms. That remains the case. But also, if you recall, we were also warning that sometimes when people who are asymptomatic, they can get a false negative report. So when you go and get tested, if the test comes back and it says that you're infected, that's something you can rely on. If it comes back and it says it was negative and you were somebody who did not have any symptoms, you need to still remember, in fact, for anybody who comes back negative, you still need to wear a mask and social distance and all those other things. We've also pointed out the misconception that some people have said that I need to get tested so that I won't get the virus. It is not a vaccine. It is a test. So I want the public to understand what it means to be tested and to get a negative test. The other reason that this increased testing capacity is so important is that for people like Mayor Turner, who are going to have to make really important decisions, they're going to be basing those decisions, the mayor will be basing those decisions on data. And every one of us has a responsibility to make every effort to make sure that that data is as accurate as it can be. And so as we've been going through this, there have been 3 types of data that I've been most concerned with. Testing, we already talked a little bit about testing. the hospital reporting of patients who are admitted to the hospital, and for a while there, we had a little bit of, I don't want to say confusion, but we had some problems with that. But as of the last 5 days, we're pretty confident that that hospital reporting of people who are hospitalized is pretty accurate and up to speed and reliable, and that's very important. And then the death reporting, and the reporters, you've noticed that sometimes we've reported on folks who have died, and it was several days ago. And there have been, sometimes the reason for that was the individual died and the test result didn't come back for a couple of days later. Other times it's been because hospitals have gotten behind in reporting. And so my message that I want to get across to folks today is, number one, to our hospital partners who have been so diligent about getting the hospital occupancy data up to snuff, I want to thank you for that. To our laboratories, I want to remind you how incredibly important it is that you report that data to us immediately, and do not cohort so that we get 600 results in one day. That is not helpful. We need that information right away on a day-to-day basis. All of your results need to be brought to us every single day. And then similarly with the hospitals, on those individuals who die, we need to know about that as soon as possible. We don't need to find out about it 2 weeks later, because important decisions are being made based on that information. It's very important that it be as accurate as possible. So finally, thank you to our hospital partners who have worked so diligently to get that information reliable. Now we have these 2 other data sources that we need to make reliable too, so the mayor can make the wisest decision that he can.
Thanks, Dr. Person. And just bear in mind, all 18 of our cases where people have passed away, died, they were experiencing underlying health conditions. So let me emphasize the importance of facial coverings. For those individuals, groups in our cities who are suffering from diabetes, heart disease, lung disease, sickle cell, on dialysis, these are populations that really should be wearing the face coverings. For those individuals, for example, in our underserved communities, communities where people have a hard time social distancing in their communities or in their neighborhoods, where there may be 5, 6, 7 people in a single home, not many bedrooms at all. Let's say like the home in which I grew up in, 2 bedrooms with 9 kids. It's hard to social distance when you're in those environments. So it's important to have some sort of facial coverings. It doesn't have to be a surgical mask or an N95 mask. Quite frankly, the one that I'm wearing today, and I'm wearing this one intentionally, this did not come from some manufacturer. This mask was made by a grandmother right here in our city. She made it. She said, "Mayor, I noticed you wear a lot of blue suits, and so I'm making this mask for you so it could go with your outfit." I want to thank this grandmother. She made it, okay? There are a lot of grandmothers in our cities. And what I'm saying to you, and let me speak to you as directly as I can, the people who have passed in our city up to this point, the 18 experience of having underlying conditions, dialysis, heart disease, lung disease. They were already on the margin, so to speak. And so for that population, please, please put on a face covering. Please, I'm asking you. As people come in and out of your house, when you're not able to social distancing as much, no fault of your own, you just don't have the means. And you work very hard, you just don't have the means. Please, please do everything you can to protect yourself. And we want to work with you as donations are made. And I would encourage people, if you make donations, and you make donations for our seniors, for example, or people in underserved communities, we'll make sure that we get those donations to those populations. We recognize that not everyone can access our community-based testing sites because of a disability or lack of transportation. The Mayor's Office for People with Disabilities is working closely with the Houston Health Department to ensure that Houstonians with disabilities have access to COVID-19 testing. We want Houstonians with disabilities who need testing to have access to this vital service. Gabe Caceres, Director of the Mayor's Office for Disabilities, has been working very closely in this area. Gabe, let me call on you.
So Houstonians with disabilities that cannot access a drive-through testing site because of a disability should call the Mayor's Office for People with Disabilities. That telephone number is 832-394-0814, or drop us an email at mopdmail@houstontx.gov. We have a process in place set so that vulnerable populations, people with disabilities who need access to testing have access to that testing. Personas con discapacidades que no pueden acceder a lugares de examinación para el COVID-19 deberían llamar a la oficina del alcalde para personas con discapacidades para acceder a ese servicio. Nuestro número telefónico es el 832-394-0814 y nuestro correo electrónico es mopdmail@houstontx.gov. Thank you, sir.
Thanks, Gabe, and Gabe is doing just an exceptional job of making sure that we reach out to people with disabilities, because in this city, we don't want to leave anyone behind. Along with our disabled community and seniors, individuals experiencing homelessness, many who suffer from chronic underlying medical conditions are especially at risk of COVID-19. We are working with the CDC, HUD, Harris County, the Coalition for the Homeless, and an array of local service agencies to create and implement an initial COVID-19 response plan with components strategically tailored for sheltered individuals, those living on the streets, and the formerly homeless permanent housing. The most vulnerable of the homeless are those living in our high-density shelters, housing up to 350 vulnerable individuals with lots of shared communal rooms and items. We work to distribute PPEs and needed supplies to shelters, distribute national sanitation and operational guidelines, ask shelters to screen residents for symptoms, and if possible, to create quarantine rooms for symptomatic residents, and to create social distancing as much as possible for sheltered residents. And although many shelters were able to implement social distancing, some were not. Therefore, last Friday, we opened an ancillary shelter, enabling our largest shelters to decompress and fully implement social distancing. I want to give a great deal of credit to Mark Eichenbaum, the Mayor's Special Assistant for Homelessness, Andy Eakin, and so many others who have worked on this project. But let me bring up Mark, and let me just say to you, he has simply done an exceptional job working with those who are homeless within our shelters, as working with the homeless who are out there on our streets. Mark Eichenbaum.
Thank you, Mayor. We've had tailored these plans specifically for different types of homeless populations. As the mayor mentioned, the most at-risk population are those living inside our high-density shelters. The facility we have up and running in concert with the Coalition for the Homeless and operated by the Salvation Army has a capacity for 150 individuals. This will allow our largest shelters to create that space so that inside our existing shelters, there's room to social distance, as well as in our new ancillary shelter, there's room for social distancing. And for those on the streets, we're lucky that we've had an ally in Mayor Turner who's helped direct 6,000 bottles of hand sanitizer, which are being distributed throughout the streets. This is in addition to over 20 hand washing stations put up by the Downtown Management District, the City of Houston, and Harris County throughout our region. Furthermore, outreach teams are scouring the streets right now looking for some individuals who are symptomatic. And if so, utilizing our innovative homeless testing program that has gone into action under the direction of Mayor Turner, so that we can get individuals who are on the streets, in our shelters, who might not have access, like Gabe mentioned, to traditional testing sites. We can get them tested and we can get them to a place to recover while we are waiting for those test results and or if they are positive. So we're continuing to do this, and we couldn't do this without we call them our first responders for the homeless system. These are the outreach teams, and these are the individuals working on the front lines in our shelters every single day to make sure to mitigate the impact of COVID-19 on our vulnerable homeless population.
Let me thank Mark and Salvation Army and all of our partners in this regard. And the key is that in order for us to be successful in defeating COVID-19, we have to make sure that we work with all of our different populations within the city of Houston, and we don't want to leave anyone out. Now, at this time, to kind of bring you an up-to-date status report with respect to our first responders, fire and police, let me bring up Chief Pena.
Thank you, Mayor. Good afternoon. So I have a little bit of good news on two fronts. I want to start off with the status of our firefighter, Captain Strawn, who was admitted to the hospital a couple weeks ago. He is out of ICU. He's in intermediate care now. He's doing a lot better. He's moving in the right direction as far as his health, and we're hoping for a full recovery and him being discharged from the hospital sometime this week. So that's positive news. The other positive news that I have is that we seem to have leveled off as far as the number of firefighters in quarantine. That's as a result of the incredible work these guys and gals are doing out there with ensuring that their personal protective equipment is on properly, assuming that every patient that they come and treat are possibly infected. So that's a protection for the patient as well as our firefighters. And certainly some of the policies that we've implemented here in the last couple of weeks. Today we have 106 firefighters in quarantine. That's down 35 from yesterday, and that's down 115 from just a week ago today, when we had a high of about 221. We have 87 firefighters that have been tested for COVID-19. We've had a cumulative number of 25 tests positive. 11 of those have since recovered and come back to work, and 14 are currently recovering at home, 1 in the hospital. In regards to our occupancy task force, we had 98 complaints for occupancies in the last 24 hours. Every one of those has voluntarily complied with the stay-home order, and we've issued 0 citations to date. Okay, thank you.
Thanks, Chief Pena. Chief Acevedo.
Thank you, thank you, Mayor. Let me start off with the good news, just like Chief Pena, and that is on Ray Ramon Cervantes, our homicide detective. He's still in the hospital, in critical care. He is still on a ventilator, but he continues to show slow but steady improvement. So on behalf of the family, I want to thank the community for your continued prayers and support, and I would just ask that you continue to pray for him and his family and his wife Liz and their extended family and everyone across the nation and around the globe that is suffering from this virus. As of today, we have 102 members of the Houston Police Department that are on quarantine. The classified sworn are down to 70. At one time, we were close to 200 sworn in quarantine. We're down to 70. Civilians are down to 32. We've had 157 members of our department that have been tested for the COVID, 151 sworn classified. We're up to 34 cumulative positive results on classified with 62 negative and 55 pending. On the civilian front, we have 6 that have been tested, 1 positive, 1 negative, and 4 pending. And I'm happy to report that we're up to 7 individuals that have returned to work. In terms of our calls for service as of today, as of this morning, we are 3% down 3%. Our calls for service have gone down 3% since COVID started. Our response here in the city, this is continuing to be consistent. The burglary of buildings continues to be a problem with a increase post-COVID of 23%. That is the buildings that are vacant, probably most of them are businesses. We need people to let us know if you want directed patrol to please contact your local station on that, the Houston Police Department, or any agency in the county if your business is closed, so we can do some directed patrols. Aggravated assaults remain at 10% post-COVID. Again, that's from, we believe a lot of that's from people staying home and not giving each other enough space, and domestic violence is up as well. I want to, on a personal note, thank the mayor for going with us this weekend on patrol in the city parks, and I want to just say thank you to the people of Houston. It was amazing for us to drive around for a couple of hours on Saturday. We didn't have to issue a single citation. There was hardly anyone that we found, and it just speaks volumes as to the commitment of our community where we've come together. We love the fact that we haven't had to issue any citations or make any arrests, and I think that speaks as to the relationship of this community with the police department, and most importantly, the trust they have for the mayor in terms of his orders. They know that he doesn't do it nilly-willy. He's very thoughtful, and I think the response to the community is proof that they trust our leadership here in the city. And again, thank you, and that's my report for now, Mayor.
And then with respect to municipal employees, the number is, in terms that have been tested positively for COVID-19, that number is now 34 as it relates to our municipal employees. And then lastly, as it relates to our vulnerable communities, I've asked the Director of Complete Communities, Shannon Buggs, the Director of our Resilience Officer, our Chief Resilient Officer, Marissa Aho, along with Julia Stepetch of our Office of Education, and Janice Weaver, who is our Faith-Based Community Director, to work together as a task force to address the education and the resource piece needed for our vulnerable communities in the city of Houston. We certainly need to do additional outreach, provide education, pamphlets, even resources where necessary to these vulnerable populations, these areas that were already on the margins prior to COVID-19. We saw these areas, we highlighted them during Hurricane Harvey. They are now being hit again with COVID-19. And so we have to be very intentional and directional in making sure that they have the education, the information, and the resources that they need. So I've asked them to work collaboratively and jointly on that, and I should be getting their assessment and reports. And then I do want to acknowledge Seema and Masood Lajavardian and Azar and Dr. Delpassan, I believe. Forgive me if I mispronounce your names. These are Iranian Americans from the Iranian community who have donated 3,000 masks specifically for those working with our homeless population. So I want to thank them for their contribution as well. Having said that, we'll pause and take whatever, any questions you may have. Did we get it all?
Mayor, well, actually, Dr. Purse, I was wondering, can you talk specifically about the testing? You said anybody can get a test if they're asymptomatic. Do they still have to pre-register, or could they just drive up? Like, what's the protocol?
Yeah, so thank you. So the registration is the same as it's been. You can either use the number or the website in order to get a number to test. And that's how we get the demographics and some of the information about age, gender, and pre-existing illness, and the things that we use to analyze so we can provide the mayor some intelligence about how the virus is behaving. So the entry is the same, except we won't be asking if you're having we will probably ask if you had any symptoms, but you'll still get a number.
So people still can't drive up to the
No,
city sites? You know,
yeah.
there's some feeling that if you sort of made it easier where people can just
Yeah.
drive up and they didn't have to go through the phone call or online thing, perhaps more folks would
Yeah,
show up.
what we're finding, and this is one of the challenges, is having a vehicle to get there with. So in fact, what's happened is the folks have shown up historically and they haven't pre-registered. They've been told that, no, you got to pre-register. And what they've done is they've driven around the block and registered and just got right back in line. Now they got the number. So it's not like people are getting turned away. They're just being told you need to register so that we can, because that's the system. And like I said, the folks who drive around the block come back in, they haven't lost that much time. Okay.
And are you guys still looking at whatever the data you can see? I know you talked about a little bit earlier as far as talking about, are there actually hot spots, or do you feel like the numbers are being shown are equivalent to
Right.
where testing sites are? Can you speak?
So your question goes to the heat map that we've produced, and it's a combined city and county heat map. And we talked about this before when we were a little bit reluctant to put the heat map out. And in the beginning, one of the reasons was we were afraid that, zip codes had really small numbers. It would actually be a violation of HIPAA. But the numbers are large enough now that we don't have that concern. The concern I have now is that the data in the heat maps is biased by the location of the testing sites. In other words, if you were to overlay the testing sites on top of that heat map, there's likely going to be a correlation as to what appears to be a hot spot and where there's a testing site, because people tend to, if they're too far from a testing site, they tend not to go. And so there's that potential bias. And then the other thing that we worry about is in neighborhoods where there appears to have very low value of very low amounts of infection, it's basically the flip side of what I just said. There may be quite a bit of infection in that neighborhood. It's just that people didn't go to get tested, so it isn't reflected in the numbers. And then the third thing is that anytime you look at a heat map, it's a slice in time. And so when we produce the heat maps, which we are going to continue to do, we'll probably produce them for the mayor on a weekly basis, you'll see that they're going to change, again, possibly due to the increased number of testing sites. But even if you had an ability to test everyone in a magical world where you could test every single person once a week, you would still see the density of infection shifting around the community, because that's how viruses behave. So it's helpful to us if we can get a lot of testing to find out where we need to focus more effort. But even when that happens, you have to remember the virus is like an electron. It's going to go the path of least resistance. It wants to go to where there are people who aren't yet infected. And that leads to another point, which I was going to make about peak, but we can talk about it, or you can ask me about that in a minute, or whatever, however you want to do it.
You want to talk about the peak?
Well, the one thing
Okay,
about, when we
first.
talk about peak, we have to be a little bit careful with that, because I wanted you to liken the pandemic to a truck barreling down the freeway with its accelerator stuck. All right, and you've seen the graphs and how the graphs are like this, right? And so it wants to go faster and faster and faster. And what the mayor has done is he has magically gotten himself into the cab of that truck and put his foot on the brake. And so when we reach the peak, and this is where this reporting earlier is the number of new cases per day, we reach the peak when that number levels off. Well, that number levels off at a high number. That means every day. So what you've done, what the mayor will have done at that point, is he hasn't stopped the truck. He's just slowed it down enough it's no longer accelerating. And so then the trick is, how do you slow it down enough and then restart society at the same time? This is extremely complicated, but my fear is that people are seeing the peak. Oh, when we hit the peak, it's all over. Absolutely not. When you hit the peak, all that's happened is you've stopped the acceleration of the virus. It's still out there, and it is far from game over when we hit the peak.
Is there anything the mayor can say as far as reacting to whatever what the governor said about possibly reopening, some executive action, and obviously what the president said? What can you speak to that whole reopening of our community and
Right.
our state?
And let me just tell you, I think we're all anxious to get to the point where we can, quote unquote, reopen, whatever that means. Certainly, whenever we get to that point where you reopen, it won't mean that everything just opens up at one time. And as you've heard people say, it's not like you turn on the switch and the lights just turn on. Whenever we get to that point, it will be a very phased in, we'll do it in stages. But before we get there, before you can draw those conclusions or reach that point, there are several things that need to take place first. We need to listen to the advice that's being given by our medical professionals, like Dr. Pers, Dr. Shaw, people at our hospitals, the medical center. So we need to listen to those medical professionals. That's number one. Number two, we need to make sure that we have what I call more widespread testing, ubiquitous testing everywhere, because it's only through the testing can you measure the degree of the community spread. And if you look at that hot map that we put out on Saturday evening, there may be certain areas where it doesn't appear to be a hot spot at all. But that's only reflective of the sense that many parts of our city, people have not been tested at all. Doesn't mean the virus doesn't exist. It just means we haven't measured it in those particular geographical areas. So we need more testing, and we need more testing throughout our city, and especially in communities that have been, in many cases, overlooked on so many different fronts. And we are nowhere close to that at this point. The federal government on Saturday just gave us permission to go to 500 tests per site. And we need more testing. We're just now opening it up to everyone, whether you're symptomatic or asymptomatic. The third thing is that we need to make sure when we do that we have all the supplies that we need. The PPEs, people are wearing the masks, so that even if you're asymptomatic, you're not spreading it if you're infectious. So we need to do all of those things. So there are many different things that we need. But I will tell you, I know I'm anxious to get us open again. I know people at their homes are anxious. But one thing I think we can all agree is that you can open the gates too soon and make your situation far worse. For people who have had other illnesses in the past, and when you start to feel a little bit better, you rushed out, only to find yourself back in the hospital, and the second time was worse than the first. I don't want the second time in the city of Houston to be worse than the first. I don't want to have had people to sacrifice, stay at home for come April 17 for 30 days, restaurants and bars and clubs to have been closed since March the 17th, conventions to have been canceled back to March the 5th, and then find we have to continue to do this for another 60 days or so. So let's, as much as possible, let's get it right as much as we can, but patience is a virtue, and then let's do it in stages based on the facts, the science, the medical advice, and then we'll move forward. So I think we all want that. I think that's what the governor wants. I think that's what the president wants. I know that's what we want. But and it has to be a collaborative decision on everybody's part. So that's a long answer, but that's the best answer I can come up with at this time.
Hi, Mayor. As a poll camera today, I have a couple of questions from some stations. First, coming from Fox, says you mentioned trying to get testing sites to area without access, like Sunnyside and East End. Has there been any progress?
Yes, UMMC opened one today in collaboration with Congresswoman Sheila Jackson Lee, right there at Cullen Middle School, which is between South Park and Sunnyside. So that's one. Director Steve Williams and I and Dr. Peirce have been talking about trying to open an additional site, for example, in the East End and in other areas. So we're pushing forward on that. We are looking for test kits along with the supplies so we can open up a number of other different community sites. So headway is being made. We're not just relying on the federal government, but we're looking at working with other community-based partners.
From Fox as well, when it comes to Texas being the second worst state in the U.S. for testing, what are your thoughts, especially with Houston and Harris County potentially becoming the state epicenter of the virus?
Well, in the absence of testing, you don't know the degree of your community spread. Now, you can do very little testing, and your numbers can look pretty good, but that doesn't necessarily mean that the virus is contained or you have mitigated or you don't have that many cases. The best way to know where you are is the testing, and you can't be fearful of running away from it. So it's testing to determine whether or not people have the virus, and then at some other point is this what we call contact tracing, whether or not people have the antibodies. So there are different type of testing that will need to be employed, and so we just need to do more and more testing. That's the best way to measure the degree of community spread. But in the meantime, what we certainly can do, what we have control over, and that's staying home, or if you're an essential employee, working safe, or engaging in social distancing, and putting on the face covering. Those are things that we have control over that we can do in order to slow the progression of this virus.
Last one from Fox. The governor said on Friday he was in contact with local officials saying he was getting more testing to Houston. Has that happened yet?
I'm going to defer to...
Just the increase to 500.
Yeah, well, on Saturday, the feds increased the number that we could test from 250 to 500 per site. So that occurred on Saturday. And I think the Texas Department of Emergency Management has been working with SETRAC and with others in order to increase those numbers. So I think everybody is engaged in this process, and everyone recognizes, I think, that we need to do more testing, and certainly that's occurring. Now, mind you, that's on the public side, but there are a number of other nonprofits, clinics, medical centers like the UMMC, the private testing that's occurring, all of that's taking place at the same time. And so a lot of public-private initiatives, and that's a good thing. That's good.
One from Channel 11, referring to the heat maps, if those, the specific hot zones, if there would be resources to that area.
Well, and that's what I've asked Shannon Buggs, who's the Director of Complete Communities, Marissa Aho, our Chief Resilient Officer, Janice Weaver, our Community Service and Faith-Based Coordinator, and Juliet Stepetro with the Office of Education, to work collectively as a task force to direct more resources, education, strategies to these particularly vulnerable areas, Because a lot of times, number one, there are a lot of people who don't have the internet. There are a lot of these individuals who are coming from communities, and they're on the front line. They may be your bus drivers, your transit drivers, your retailers at your grocery stores. They're on the front line. And so they may not have access to all of this information, and we have to find ways to get it to them. A lot of these individuals may be unemployed. There are a number of different elements that they are facing in their own lives, and we have to do as much as we can to take the information and the resources to them. Just like the testing, we have to take it to the areas, to the neighborhoods that they come from.
Last one from KPRC. What is your stance on the use of antibody tests currently being offered by Merit companies?
I didn't hear that last one.
What is your stance on the use of antibody tests currently being offered by a Merit company?
Well, I support it, but Dr. First, you want to take that one?
So thanks for this question, because this is one of my favorite areas where there's a lot of confusion. There's the tests for the virus. They're the ones we've been historically using. And there are a lot of companies that are coming out with the antigen or the immunoglobulin test, okay? The antibody test. Antigen is for the virus. Antibody is the one that's coming. This is the little blood test. A couple things. First of all, those all require FDA approval, and with the exception of one, none of them have FDA approval yet, and the one that does, it's not for diagnostics. So they need to get that through. So that's something that has to occur at the federal level. But probably more importantly is people need to understand what that test looks for. The salespeople I've been disappointed with, and I've argued quite loudly with them, is they are advertising them as if they are a test to see if somebody has the illness. That is not true. That is a falsehood. That is inaccurate, and they need to stop doing that. The immunoglobulin test sees whether or not you had the illness, and your immune system has now risen to the level where they can test and find it. So it would be useful, there's a great use for that as we move forward to find out, it may be in the strategy to reopen society at some point, but it is not a good test to see whether somebody has the illness. So first of all, they need to get FDA approval. We need to find out what the sensitivity and specificity and all that is, and then we need to find out exactly where in the equation of its usefulness it exists. But today they don't have FDA approval, and they're being a little bit misrepresented as to what they actually test for.
I just had a question from, oh, sorry, Ray.
No, go on.
No, I was just going to ask, the police chief, if he's heard anybody of anecdotally, we've heard a few cases of people like stealing PPEs. I mean, not donating, not giving, but like actually thieves taking them from people.
I only know of one case where some PPEs were stolen, but that was a couple of weeks ago. I don't know of any current cases.
Do you have any message?
Well, we catch you, we're going to arrest you, obviously. It's silly season out there, and this is the time we need to come together, not going around trying to steal stuff. There's plenty of opportunities to go to different NGOs and even different facilities to get a mask, and quite frankly, like the mayor just said, these are not that complicated to make. You can probably make them with rubber bands and a t-shirt like the Surgeon General showed on the whole country how to do pretty easily. So there's no need to do that.
All right, let me thank everyone. I will say we've given you additional numbers, the 115 new cases today, 2 deaths, at bringing the city's number up to 18. What I will say to you, even though the numbers are where they are, and we look at the data reports coming from the hospitals covering 9 counties, we are still within the base capacity of the hospitals, for example, when it comes to ICU beds, when it comes to ventilators. So that's a positive. Now, of course, all of this is subject to change the next day or the next day after that, but at least where we are right now, if you're looking just where we are. And the reason why I'm saying that is that the goal has always been to slow the progression of this virus so that our healthcare delivery system would not be overwhelmed. On this day, let me put it this way, on this day, we are achieving that goal. And so I want to thank you for your social distancing. As Chief Acevedo said, I want to thank you over the weekend. Literally, it was almost 100% compliance, almost literally. And I want to thank you for that. And so I'm going to ask you to continue to engage in social distancing. I'm going to ask you not to overwhelm our parks. Don't make it hard on other people who want to go out there and walk or jog, and they have every intent to be 6 feet apart, and then people come in groups and they start crowding the parks, and then you force us to start closing the parks and shutting them down. So thank you for what you're doing. I want people in the city of Houston to know on this day, and this is what, April the 13th? And so bear in mind, it was on March the 11th, where it was on March the 5th that we canceled the first conference, the Sarah Week, where it was 6,000, 7,000 people were going to come to the city of Houston. We canceled that. That was on March the 5th. On March the 11th is when the Houston Livestock Show and Rodeo came to an end, on March the 11th. On March 17th is when we suspended the service of restaurants, bars, and clubs, with the exception of carry-out or take-home. On March the 24th, the judge issued the stay-home, work-safe order. And now today, on April the 13th, we are here, and the goal has always been from the very beginning to flatten or slow the progression of this virus so that our healthcare delivery system would not be overwhelmed. At this point, we are achieving that purpose. If we continue to apply the brakes and do collectively engage in the shared sacrifice, then the hope is tomorrow we'll be able to claim victory on that end and the day after that. But now let's really pay special attention to our vulnerable populations and people who are already on the margins. Having said that, thank you all so very much for your cooperation. Thank you. Thanks, Chief.